right, and welcome to the Thursday edition of KSRO's Ask the Expert. I'm Robin Berardini, each and every week with you, Dr. Walter Tom on Ask the Expert. He is our expert today. Dr. Tom, you've been here for a long time now. It's awesome.
We've been doing this for a while, haven't we, Robin?
It's
yes,
wonderful.
We have.
So you strongly believe, let's do the little plug for Aesthetic Laser and Vein Center. 3 locations now, Maui, Napa, Santa Rosa. Remember them at drwaltertom.com, laserandvein.com, 707-542-8346, streaming on Facebook Live, and then you're adding this new little dimension.
This is going to be our first show. We're going to be going on YouTube. Exactly. So we got to stay up with the times. Stay with. Always love education. So that's one of. Did you know that YouTube is actually I believe the #2 search engine right now in the world, and so it's just another way to educate and reach out to our patients and to listeners.
It's wonderful, and you never and people are viewing from all over the world, which is very interesting as well.
It is interesting. One of the things is that we're known for is that we do, and I know we're not talking about surgery today, but we do a lot of surgery under only local anesthesia, and it's interesting to see where we get phone calls from all over the country, even though we're just a little old wine country here in Santa Rosa, California.
Yeah, it's amazing, that reach. And Adele, our lovely Adele, is behind there getting the video. She's doing our videography today for YouTube, so we thank her, and Mike DeWald, our producer engineer. Dr. Tom, getting back to you, Dr. Walter Tom, strongly believing in education, featured here on Ask the Expert for over 10 years. You share your passion in education, teaching and lecturing both nationally and internationally. Past president of the California Academy of Cosmetic Surgery and product diplomat for many years, and on the board for the American Board of Cosmetic Surgery. And we welcome you today. Thank you for being here.
Thank you.
And all of you, our listeners and our viewers, we appreciate that. And helping us looking younger every day by Monday. And as we near, holidays and whatnot, I think it's important to, whatever kind of procedure you want to get in, if you want to get in before the holidays, you should give the Aesthetic Laser and Vein Center a call now to get on the books, because things are booking up. And as we go back to that tried and true looking better by Young Monday, you have a gold standard that you really, really like. And it's maybe not as sexy as some of the other procedures, but tried and true nonetheless.
That's right. So we're real fortunate that Robin every week gets a hold of me. So, what, Dr. Tom, what are we going to talk about on Ask the Expert on KSRO? And so, we kind of go over we'd love to talk about the new latest and greatest technology. Maybe there's a new technique that we're bringing to the forefront. And today being November 21st in 2019, and right before the holidays, right as we're moving in, I think that our battle cry of Look Younger by Monday is really important for patients, because now they're kind of thinking, what can I do? Holidays are coming. I want to look my best. And so what I'd like to talk about today is a procedure called photofacial, or based on intense pulsed light. And it's one of the oldest forms of light energy or lasers that we have used at the Aesthetic Laser and Vein Center and in cosmetic medicine, in the world of cosmetic, plastic, aesthetic medicine. And although it's one of the oldest, it's still, in my opinion, one of the gold standards of treatment for patients. Actually, some 20 plus years ago, I was originally a general vascular organ transplant surgeon, and did that for quite a while. As I began to develop the Aesthetic Laser and Vein Center, I went out to look for a technology to treat veins. And so for those who are in the industry, you'll laugh, it was one of the very first lasers that I bought was the Vasculite, VASCU light, L-I-G-H-T. And I bought that actually to treat leg veins. Okay. Interestingly enough, and so you want to go to someone who has some experience, because we listen to all the hype in cosmetic medicine, and let me tell you, there's a ton of hype in cosmetic medicine, and we've had the time to kind of study technologies, have experience with them, so that hopefully we can tell our patients what really works and what doesn't work. Sure. So I bought the Vasculite originally to treat just spider veins on the legs, and I have to tell you that I was woefully underwhelmed with that. I was underwhelmed with that. When I bought this very expensive technology and brought it to Santa Rosa, I was also told that not only could it treat leg vein, spider veins, but that it also was good for performing a procedure called photofacial. or intense pulse light treatments on the face.
So it's a two for
and it's a 2-for-1, if you will, right? And so I went down and I trained with a Dr. Patrick Bitter Sr. Down in Los Gatos, who is one of the sort of forerunners in cosmetic dermatology of using photofacials for treating rosacea, redness, and pigment, reds and browns on the face. At first I thought, I'm not really interested in that. I was a general vascular transplant surgeon. I'm a real doctor, and I'm not going to kind of get into this cosmetic things, and lo and behold, look what I'm doing now, right? And that's what life does. Life throws us curveballs, and we move with those curves. So I went down there to learn about it, however, and as I said, I was sort of underwhelmed with this technology in treating leg veins. Okay. But lo and behold, it was really fantastic for treating the skin of the face. Okay, and in particular, what patients would come in to see a cosmetic dermatologist or come to the Aesthetic Laser and Vein Center here in Santa Rosa and Napa, or at our office in Maui, is that they would have some concerns. They may have some sun damage of the face.
Yes.
Okay, so it would be the browns, sun damage, maybe some spots on their face that they don't like. As we get older, sometimes we develop spider veins in the cheek area, and that can be real bothersome for patients, both for women and men, because we believe that people look at us and think, oh, we're a drinker, you drink a lot of alcohol, and that's why you have these spider veins. And then there was a subset of patients who have rosacea, and if you don't have rosacea and you want to know what it is, it's really an entity that we see mostly in Northern Europeans, although I've seen it in Asians and Latinos as well. But it's where you get a red flushing of the skin, and it can be related to temperature changes, eating spicy foods.
Is it hormonal?
It may be hormonal. We don't have all the answers. It's one of those entities where we think we know what causes it, but we really don't have the exact etiology or cause of that. But you get this redness that occurs. You can get spider veins that develop on the cheeks. You can even get breakouts with this.
Yes.
And in England, many years ago, their big medical journal called The Lancet, they actually described rosacea as the most socially embarrassing disease for humans. Okay, what does that mean? Well, it means that the people who have that, they may not be embarrassed, but they then become embarrassed because they look red, they look like they're embarrassed, they look like they don't have the confidence to deal with things. And so we see this in men and women, and they come in to the Aesthetic Laser and Vein Center, and one of the best treatments for them is a photofacial or intense pulse light.
That's incredible because there's so many elixirs, may I say, old school word, but the topical treatments that they don't really work.
For rosacea, I would have to say that's true. And again, I'm not a dermatologist, I'm a cosmetic surgeon, but that we find that most of the medical treatments may help a little bit, but the photofacial treatment for rosacea is still probably the most gratifying treatment that we can offer a patient with rosacea.
Miracle, really miracle,
we kind of jumped ahead a little bit. We should probably talk about what photofacials are, intense pulse light. So the concept of intense pulse light or a photofacial is that we have a handpiece that has a little crystal, which bright light is flashed through this crystal. And we put a cold gel on the face, and then we pulse the face, the skin of the face, with this bright light, intense pulse light, hence the term IPL, and that light energy is then absorbed by pigment, very much like a dark shirt or dark suit on a sunny day, or like your sweater, and so the heat, the light energy will be absorbed by this pigment. It becomes irritated, damaged, and then your body has little cells that may go in there and help to eat away at this damaged tissue, like little macrophages. I'm going to show my age because like Pac-Man, like little Pac-Man's coming in and taking away the pigment. Or you may find if you have sun damage and pigment on your face when you have a treatment that it looks like you have dirt. In fact, somebody wants to kind of lick their thumb and kind of rub it off your face, if you will, but that's what a photofacial can do. So specifically for sun damage, the pigment itself, not necessarily wrinkles, but for the pigment itself, sun damage, sunspots. If you're a baby boomer like I am, we've heard the phrase liver spots. That's what a photofacial or intense pulse light can help tremendously with helping to reduce the pigmentation or make it disappear.
So skin texture and pores, is that in there
So,
as well, maybe?
as a caveat on this, because of just the energy of heating up the skin,
Okay.
when we do this, you actually get some shrinkage of the pores,
Ooh, nice.
which is really nice for
Absolutely.
patients, especially around the nose area. And then also in terms of texture, you feel like your skin's just a little bit smoother. When they first came out and they were talking about photofacials, oh, it's for fine lines and wrinkles. And I'm going to tell you, if you have fine lines and wrinkles, this isn't the treatment.
Okay, that's
Think
fair.
of photofacials or IPL as treating color, superficial
right.
color.
That helps.
So it's the browns.
Right.
It's the browns of hyperpigmentation, okay? Or it can be the reds of rosacea or flushing that people can get.
That dovetails into the spider vein.
And then it goes into the spider veins,
Okay.
exactly.
I gotcha.
In other words, the reds and the blues of the spider veins. Think of the photofacial as being effective on color.
All right, that's fair enough. But then could be a subset of people that have increased help with the acne scars or the dark circles under the eyes or reducing maybe a little bit of fine lines, but that's really not what it's known for. Is that what you're saying?
That's correct.
It could happen, but
Correct.
maybe not what they were
What I find when I have the treatments, and I've been a patient of this myself, and I love the treatment. In fact, when we have our morning meetings with our office, many times I'll tell our own staff, I say, listen, I know that it's not the latest and greatest, this treatment, not the sexiest treatment anymore, as you had mentioned at the beginning of the show, but photofacials are still, in my opinion, the gold standard for treating pigment in a very efficacious way. Simple treatments. Normally we recommend one treatment maybe every 3 weeks for a series of 3. Okay. And then after that you do maintenance. So maybe you have a treatment once every 3 months or 6 months or a year. Just depends on what you're treating.
Sure.
But if all of us, as I challenged our office staff, I said if all of us had a photofacial treatment, let's say once every 2 months, our skin would look great. Okay, and so we're just like the shoemaker's children who run around with holes in their shoes, so we don't get enough of our own treatments, right? But I've actually have just started because I have an office in Maui, and so the sun damage that occurs with that, and so I just had a treatment about 3 weeks ago, and so I'm going to try to get myself and try to walk the walk and listen to my advice I give my patients,
Get that
and have a
base
treatment exactly about every 3 weeks, and I'd like to probably go out to a series of 5, and then maybe do a treatment once every 3 months.
The treatment itself doesn't take a lot of time. It sounds like it could be a lunchtime procedure. Is that fair?
Completely a lunchtime procedure. The actual time of pulsing the skin, putting a cold gel on the skin and then pulsing the skin and completing a treatment maybe is half an hour. Now we set aside an hour for you because we don't want to rush things. We want to be able to explain the procedure to the patient as we move along. But it only takes probably about half an hour of actual treatment time.
That's not bad. And then, okay, so speaking about the face, are there other areas that you could use the photofacial or IPL that may be beneficial to your patients?
Yes, so are there other areas that we can treat? And you're setting me up because I know this is one of your favorites. Okay, so yes, So with the photofacials, even though it's photofacial, which we think of the face, of course, but treating the neck area as well. So especially in Northern European patients, what we find is that they may have some redness on the neck. It's called the fancy phrase poikiloderma savat. And it's a great treatment for treating in the neck area and this area here. We also find in the chest, even though most of us nowadays are pretty good about putting sunblock on the face, and maybe if we're lucky we put it on our neck, but a lot of times, especially for women, they forget to put it on their chest, and because they're buxom and the breast brings the skin up to a different angle, it really is very susceptible to being hit by the sun, by rays of the sun. And so we see sun damage in the décolletage, and so this is another area that works really well.
And that skin right there in your décolletage area is very sensitive, isn't it?
It is.
It's kind of fragile.
Right. So technically, when we train new nurses on our team for this, we tend to go a little bit heavier strength, a little bit stronger strength of the intense pulse light on the face. We come down a little bit because as we move down on the neck, because the neck skin is a little bit thinner. And then, as you said, especially in the décolletage, in the chest area for women especially, what we'll do is we'll actually even come down a little bit more. Okay,
Nice.
but the results, I really love having that area treated for patients. They see a huge difference when they treat the neck and chest area for that red poikiloderma sevata, that red sun damage area, and hyperpigmentation that can occur in that area. Most people really love that treatment.
Absolutely.
Yeah, it's a real nice treatment.
And then also, I'm going to say, this is an area that I know a lot of women, and it can show your age, your hand. You can have a woman that's done, or a man that's done a lot of, maintenance, and then you put your hand up to your face, and you're like, oh, goodness.
Yes, that's true. The hands
Is that
kind of give
fair?
away the age. Absolutely. There's, again, I'm an aging baby boomer, but there was sort of a movie star of that era, and she still looks fantastic. I'm not going to mention her name. I think it was a Vanity Fair photo shoot, and she looked great, but her hands were up there, and you could see, her hands kind of gave it away that she was aging baby boomer, like a lot of us are. Okay, and so. It's a lot of times it's the hyperpigmentation. In fact, especially if the men are listening, this is something that men get a lot. A dear friend of mine, who was the chairman of one of the local banks here, he actually golfed a lot, and he came in because he didn't like the sunspots or the liver spots, age spots on his hand. We treated him, and he loved the results, and he started to golf with two golf gloves on instead of one to kind of keep the sun from causing more hyperpigmentation. So the hands are another great area to treat.
And you can do that all in one session?
We can do that in all in one session.
All right. Well, we're talking about photofacials, one of the gold standards under the umbrella of Dr. Walter Tong's Aesthetic Laser and Vein Center, also called IPLs. We're going to take a short break and be right back after this on KSRO with Dr. Walter Tong.
And Latte's here in